Welcome to Restore Physical Therapy, where we'll be talking about shin splints, or medial tibial stress syndrome. Shin splints are often caused by overuse or from strain of the muscles of the lower leg from poor form or malalignment of the foot, like overpronation. You can prevent the shin splints by shoring up the shoe with an orthotic or with a softer shoe, adjusting how you're active. If your activity is putting too much stress, like always running in the same direction on a track, being on a soft surface, or an angled road always in the same direction, you can easily change that by changing directions. Your physical therapist will help you to figure out what your risk factors are. If there's an intrinsic problem like tightness in a tissue in the leg or a weakness in a muscle causing it to be overused, we'll help to find that for you. To figure out if you have shin splints, you need a physical exam. Either your doctor or your therapist can look at your symptoms and help you to figure out if this is your condition. Once your condition is improved, you then have to figure out how to avoid having this condition again. Hopefully, in your treatment process, you figured out what the precipitating factors were, and you've taken some steps to correct them, and now you're into cross-training instead of always doing the same activity that may have caused this to start. Or you've switched directions on the track every once in a while. So hopefully, once you've resolved this condition, you won't have a return. So, if you need physical therapy for your condition, we hope to see you here in the clinic.